This exercise is to provide mobility to your lumbar spine. You would require instruction in the physical therapy office first before attempting to do this on your own. This exercise with a foam roll is designed to provide mobility to your lumbar spine in ways that you cannot provide it on your own. The first exercise is to provide a mobility to your low back by pretending that the foam roll is taped to your back and your head. And what you're going to do is to dip down towards your shoulder. Your entire body will roll with the foam roll exactly, just like that, going side to side. I'll generally have patients do 10 to 20 times of this first movement, dipping themselves side to side, keeping their head and their low back and their bottom on the foam roll. You may use your hands to stabilize yourself and to make sure you feel comfortable on the roll. The next exercise is to change that and to glide across it. So I'm going to pretend that you're the cookie dough and it's the roller. And so the rolling pin is going to roll across your low back. You're going to keep yourself parallel to the ground. Again, you can use your hands for balance. You're going to go side to side, but you're not going to dip. You're going to keep your shoulders equal or parallel to the ground as you go side to side. I would again have you go 10 to 20 times. This should feel like you're getting a massage to your mid-back region. The next exercise is designed to mobilize and stretch your upper back. So you're going to clasp your hands together. You're going to bring them across and over one side of your head and go to the other side, almost like you're going around in a circle, just like that. I generally have patients go 10 times to one side and 10 times to the other side. And what that causes is it causes them to mobilize their thoracic spine, but they also get used to lying on the roll and firing off muscles that hold their spine still, or what we call their stabilizers. After doing 10 or so of those exercises, the next one is to clasp their hands together underneath their neck and their head, bringing their elbows together. In that position, you're going to rotate your elbow down to the ground, letting your head rotate with your perfect. If you can touch your elbow, great. Most patients cannot. They don't have enough mobility, so they do what they can do. So they're supporting their head with their hands, letting themselves go side to side. This again teaches their stabilization muscles to fire off, helping their low back. The next exercise is to give yourself a little bit of a test to see how strong your low back is. Resting your hands on your stomach, taking them off the floor, you're going to lift one leg at a time. You're only going to hold it into the air for approximately 2 to 3 seconds and then set it back down. Then you're going to shift your weight and lift the other side. For most patients that have low back pain, they will have a difficulty lifting one or both of their legs. And when that happens, it usually is evidence of weakness on the opposite side of the leg that they're lifting. So we're trying to strengthen those muscles through the other stability exercises. After performing that test, I'd like you to glide across it just like we did on the second exercise, keeping your shoulders parallel to the ground, gliding across the foam roll. Go ahead and glide back and forth across. This exercise generally will take 3 to 6 minutes depending on the person's ability to tolerate the foam roll underneath their back. After they've done this exercise, I have them roll off to the ground. Let me have the foam roll, lie back onto your back with your knees bent, and you generally will feel that your back muscles have relaxed and that more of your back is in contact with the ground. It's a way of providing segmental motion to your spine without putting a large lever force through it. It's usually very relaxing.